Hello everyone and welcome back to the Clinical Cousins YouTube channel. Today we're going to go over the drug Alprazolam, also known as Xanax. This drug is classified as an anxiolytic or anti-anxiety medication, and it is a benzodiazepine. It is given for generalized anxiety disorder and panic disorders. It cannot be given with ketoconazole, St. John's wort, or valerian because they will have a synergistic effect. Also, use caution with other benzodiazepines and central nervous system depressants as they can cause respiratory failure when they are taken in combination with each other. Now, it is important to know that in pregnant women, it can cause neonatal withdrawal syndrome. This means that you will have a fussy baby. Be sure to check the newborn for signs of respiratory depression like grunting, nasal flaring, and intercostal retractions. This drug binds to our GABA A receptors, which, if you remember from the previous videos, are coupled to chloride channels. Once these channels are open, chloride will flood into the cell, making it less excitable. This will depress our central nervous system, aka our brain and spinal cord. You should be aware that if a person decides to stop taking Xanax, they can have an increased risk of having seizures. Because our brains have had a steady supply of depressants, it gets lazy and doesn't make enough of our own neurotransmitters. Therefore, when we stop taking our depressants, our brains cannot produce enough inhibitory postsynaptic potentials, and we are at a higher risk of developing an electrical storm in our brain, aka a seizure. This drug is metabolized by the liver, has an onset of 1 hour, and will have effects that can last from 12 to 24 hours. The side effects of this drug may include drowsiness, headache, depression, constipation, dry mouth, short-term memory loss, respiratory depression, decreased coordination, and psychological dependence or addiction. Some commonly tested material about this drug is that it can cause seizures with abrupt withdrawal. It can cause sedation, which precedes respiratory depression. It can cause dizziness, addiction, and it should be avoided in the elderly if possible. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.